We hit the live button, and we're working through right now, guys. If you're just logging in, we've got about another 400 people that are going to jump on. We're at about 150 already. Now we're at 200. So give us 1 second to just let everybody get on before we get started, because we don't want anyone to miss the beginning of this. Otherwise, they'll be lost. So give us just 1 second.
Welcome, guys. If you're just logging on, we're just letting other people log on, and then we're going to get started. So just stand by while people get logged on, and we'll get started. That's funny, Sabia. Thank you.
So as you're logging in, we're up to about 250 people. As you're logging in, you will not be able to talk. You will be able to communicate through the question and answer and the chat windows. To find those, what you do is you go to the bottom of the Zoom window that's active, your active Zoom window. Go to the bottom there, and there will be a pop-up menu that will come up, and it will have a Q&A, and it will have chat. Chat is for all you funny people that want to tell jokes. You can shoot your jokes in the chat window. But if you're serious and you want to ask a question, ask the question in the Q&A part, because what we're going to do is we're going to tally those up, and then at the end, we'll actually go through those questions and answers.
Thanks, Amanda. All right, let's do our entries.
So we're at 300. We still have a few more hundred going. So we're real close to starting, guys. Hey, John, good to see you too. So this is our live video today. So this is live television, so to speak. And the first time we're using this technology, and we're actually using the technology over 2 different sites in order to bring you this content. So bear with us as we go. There may be a couple little glitches as we learn where the buttons are, as many of you are probably learning where the buttons are at the same time.
And just so you guys know, we are recording this, so we'll have it available for you. If you know somebody who missed this webinar, we'll be happy to let them have access to it.
Yeah, somebody just asked, will this be recorded? Yes, we are recording this, and we will post it. So if you've already logged in and you have to step away for a minute, you'll be able to get this later, as well as a lot of the content is so rich and so valuable. You're probably going to want to step back through it. So if you're writing notes feverishly, don't worry. If you miss something, it will be captured.
Yeah, and just to give you a quick outline, guys, we're going to go through some things about how the law is changing for team members in labor and employment. So if you want to stick around, we got some great information for you, and that's kind of our outline. Let's do our introductions.
Yeah. So I'm Dr. Rob. This is Dr. Bobbi, and we have with us Lira Johnson today. She is an attorney that specializes in employment issues. Our overview today is we're going to start with just a little introduction. Then we're going to just really turn it over to Lira. She's going to give us guidance on the questions that almost all of us are struggling with right now, which is how do we keep our businesses solvent, and how do we take care of our people? How do we take care of our teams? Those are the 2 main things that we want to try to get out of this meeting today. At the end, what we're going to do is we're going to queue up a lot of the questions and answers for the end, because she's got a nice presentation put together, and she's probably going to answer most of your question as she goes. And then at the very end, we'll just wrap it up. So the first thing I wanted to do is behind me on the screen, if we'll just move out of the way, these are a few of our sponsors. These people were responsible for helping us get this technology put together so rapidly in order to bring this important information to you guys. So we just want to say thank you to all our sponsors, and we'll be talking more about them in future broadcasts.
Yeah, and just in case you can't see the screen, I do want to run through who our sponsors are. BioHorizons, Hugh Freedy, Acteon, NDX in Sequence, the American Academy of Implant Dentistry, and then of course Lira's group, which is Dinsmore and Scholl LLP, their legal counsel group. So thank you guys all for being involved with this and helping us put this together.
And probably the last thing I want to do before we turn it over to Lira is that her company is nationwide. So she's going to be talking from a high level, but each individual state is going to have their own state requirements. And she'll just say, for your particular details, you're going to need to talk to somebody specific in your state, and she can help you with that. You'll have all that contact information before this is over, so you can get in touch with her and her team if you want to. So without any further ado, Lira, why don't you take it away?
Thank you, Dr. Rob and Dr. Bobbi. So welcome everyone, and thank you for tuning in today. We're going to spend the next 45 minutes to an hour to talk about the questions that have been coming at us really fast. And I want to begin by saying that this is a very unusual set of circumstances in every way for an employment lawyer to address. Because typically, if you're going to be thinking about decisions to open or close a business, to lay people off, to stop working or idle for a period of time, you would have had at least a few months to think about it. And we would have had several conversations before you actually decide your final action. But now we're trying to make these decisions in a matter of days or even hours sometimes, as states roll out new orders and as the landscape changes so quickly. So I want you to know that this is not you, it's the state of the world that makes it feel really, really strange and overwhelming. But we're going to try to put some order on it, and we'll walk through some things. This is a presentation geared for a lot of different levels of employer. So if you already know some of this, just bear with us. And if you haven't seen it before, try not to get lost. We'll send the whole slide deck over to Dr. Rob so that he can post the slides as well as have the video available. So let's get started. And what we're going to start with is a little bit of background about how did we get in the situation that we're in right now. And you'll see in a minute that that's very important. I know you're healthcare providers, and I know some of this is going to be a little old news to you, but it's going to be important to think about everything you're doing right now in the context of the coronavirus, because this is a problem created by the coronavirus, and this is, to some extent, the situation we find ourselves in 6 weeks or in 2 months is going to be dominated by the coronavirus as well. So we should be thinking that in that framework. As you know, the first time we dealt with a pandemic in this country and prepared our pandemic plans was when we had the MERS and SARS outbreaks. And this is not that unlike those outbreaks. And so if you prepared a SARS emergency pandemic plan for your practice a few years ago, get that out, dust it off. You can update it with a lot of the things that you already thought about then for your team now. But typically, as you know, we have a little more time to prepare for something because it's not something that we're all immune to in the entire world. And right now we've got illness affecting at least 16% and sometimes as much as 30% of a population with severe symptoms. And that's what's led us to where we are today. We've got an ever-changing array of information about this. And what we've learned is that people don't typically show symptoms in the very early stages of exposure. So they could be infected and they could be shedding the virus and infecting other people, but showing absolutely no symptoms. And we've seen Senator Rand Paul telling everybody on TV he feels fine. We'll see if he still feels fine in 10 days. The severity of the symptoms will vary significantly by the individual, but we've learned some common symptoms, and they're more than what you've been seeing on the CDC. So I think everyone should really focus on this. Our colleagues, ENTs in the Medical Institute in London have come out with some really interesting new information in the past 24 hours. So what we see is symptoms of the virus are fever of 100 degrees or higher, cough, and shortness of breath. You've heard this. What we have recently seen from the ENTs, and this is corroborated with by folks in China and in Italy, that 30 to 50% of the cases that will probably end up just being mild cases begin with nothing more than the temporary loss of smell and taste. Can't smell anything, can't taste much. And that might be the only symptom they ever complain of, but they're positive. 30% of cases will progress to a severe headache and very sharp pain in the throat and aches in the sinuses, but no congestion. That's another very early warning sign. So if you have patients or you have employees with these symptoms, it's likely, again, in the absence of testing, we won't know, but it's likely that this is the onset of the COVID-19. If any of these symptoms are present, you're gonna have to follow your local and state guidance on what to do. As you know, the hospitals have been preparing special plans to get people in a special door, to get them to negative pressure isolation rooms as soon as possible. But right now, they're telling most people, if you don't have the severe symptoms, you shouldn't be seeking care. But if you have these symptoms, you should be self-quarantining at home. And some states are actually ordering you to self-quarantine. Or similarly, if you have a patient that comes in, you should screen them before you start working on them to be sure that they don't exhibit any of these particular symptoms, because working on them could be very hazardous to them and you. We know that the folks most affected by COVID-19 are older adults and those with chronic medical conditions, underlying problems like diabetes or compromised immune systems. Caregivers are a special risk, and the ENT group in London put this information out because they've had ENTs that have come down and in fact died after having done endoscopy or other things on patients who had these very preliminary, strange lack of smell, lack of taste symptoms. Also, of course, travelers and pregnant women are going to be at higher risk. Although our healthcare providers and the WHO are still trying to determine how the virus spreads, what we've heard a lot about is coughing or sneezing on someone. Of course, there's also some pretty clear evidence that this, like measles, can hang in the air for between 3 minutes and 30 minutes after someone has been in a closed location. And that's the reason why everyone is supposed to spread out 6 feet or more. And if at all possible, not work in the same area, but work remotely, because of this person-to-person transfer that's going, as best we can tell, similarly to measles, through the air. It's also, of course, possible to have a contaminated surface that passes it along. And that is why the best guidance is also to be really vigilant about surfaces where more than one person is touching them. The other thing, of course, that's created the situation we're in is the timeline of this virus. It's spread incredibly quickly around the entire world, helped by technology, of course, but also helped by the fact that people don't show the symptoms early on. And so you've got people that are sick, they're shedding the virus, but they have no symptoms, and they're contaminating other people because they're in close contact with them. You can see cases just from January 20th to January 28th skyrocketing, and you're going to see it was around the 1st of March that we start seeing cases reported in Italy, Iran, and the United States. So we got where we are really quickly. And so if there's any hesitation out there on these kind of extreme measures about closing and staying home, look at the data. The data shows that we can barely stay ahead of it. The data also shows that if you can quarantine for about a 15-day period very strictly, you're going to see these infection rates drop off. And so you're seeing a significant decrease in about 10 or 15 days, and another one in 5 days, and so forth. Where right now, it's fortunate that Wuhan itself is reporting little or no case activity in the last few days. So we know that this kind of extreme isolation can work. Of course, we're not having extreme isolation right here in America right now, so it's all unknown.
I gave this presentation. Interrupt for just 1 second. For those folks that are just joining us, we apologize. Apparently, a lot of you had to get a new link sent to you because the response to the interest in this was so big that it kind of brought down the system a little bit. But we apologize. Lira is giving us a high-level view of where we're at right now, and is going to shortly jump into details on how to handle our employees. Go ahead, Lira.
So the other thing is that I gave this presentation last Wednesday on the 18th, and I wanted to show you a little bit. I was changing all the data this morning, and then I decided let's just leave it up there so you can see how we've moved since last Wednesday, the 18th. Domestically, we've gone from 7,301 identified cases to more than 35,000. Domestically, we've gone from 116 deaths to 458. We don't know how many recoveries because nobody's tracking that right now. At least I couldn't find it. And worldwide, We went from 8,272 deaths to more than 15,000 deaths. Iran is not reporting all of its deaths, and some small countries aren't reporting deaths at all. So, so you can see that this has been significant since in less than a week. This is the data that we have. So again, very serious issue. So when we typically think about what to do with our employees, keeping them safe and whether or not to lay them off or to give them leave and so forth, we're looking at just a plethora of laws. There's no one single law. There's several laws, as you know, that cover all these areas. I've listed the federal laws for you here. Of course, as you know, our law in America is one large federal system of law and then a state by state, 50 different state laws. And then there are also, if you're in a large metropolitan area, you probably have local laws as well that you're going to have to follow. And so in employment, it's no different. The federal laws are listed here that might come into play, but also you're going to have state laws on a state-by-state basis that are going to vary significantly from each other, and then local laws as well. And what's really unusual about this circumstance, and I've never had it happen at such a fast rate in so many places, is that all of those laws, the local, state, and federal laws, are subject to being suspended for public health emergencies. Really, you've seen emergencies before where FEMA stepped in when we've had tornadoes, earthquakes, large fires. It's not really unlike that. It's a series of public health laws that percolate down all the way to the city or county level in most states. There's a county public health law that allows, in that county, public health officials to respond as needed to the public health emergency that's happening there. And the only time I've ever had it happen like this before was with measles. So there's been some, very hot spots with measles. They would break out here or there. The public health authority would swoop in, would close down, and then determine when to reopen, and it would be contained. We've never seen anything, obviously, as large and sweeping as what we have now. And so the reason that you're feeling a lot of confusion is you're hearing from your local public health authority something, you're hearing from your state emergency activation plan or state public health laws another thing, and then you're hearing something else different yet still from the federal level of public health emergency. And it's very confusing until you stop and think about it. It's just like every other law. It's just you're hearing about it in such a quick succession that you don't have time to figure out which one you need to comply with. And I will just tell you, you need to comply with the most restrictive guidance. So if that's your local city and your local city has said shelter in place, except if you're these 5 businesses, you've got to comply with your local public health authority first, your state second, and then last, the federal. Right now, the federal is the most lenient of all of those because, and it makes sense, when you think of it, these public health emergencies they're local or sometimes statewide, but it's very rare that we would have a shore-to-shore sweeping public health emergency. And that is why the federal government, to a certain extent, is lagging behind. So at a bare minimum, you're going to need to know the telephone number, email address, and website of your local public health authority so that you can be in touch with them and report to them and hear from them when they have questions. And then you're going to need to monitor your local and state instructions on how to find the most current information. We suggest tapping somebody in your office to review the state and local postings at least twice a day. And then your industry-specific postings, or if nothing else, the CDC postings once a day, and to follow the most restrictive guidance. It's getting to the point where it's really hard for one person to monitor all of this. So it might be a team of a couple people that are looking at these different things each day. On a day-to-day basis, we're having new warnings that have to be posted, new restrictions that are rolling out. Since this morning, Indiana has issued its own shelter in place. West Virginia has issued its own shelter in place. And Kentucky has a new, slightly different version of what retail organizations can do. And that goes into place at 8 o'clock tonight. So as you can see, it's really moving quickly, and you need to be aware of the states where you're practicing in. You need to be aware of where you can get that internet guidance. Of course, it's already important that you have posted all the public guidance. For example, here in Kentucky, there are signs that need to go on all the public entrances and all the service entrances that say stop and do not enter if you've experienced fever or coughing or these various shortness of breath issues in the past 24 hours. So state by state, you should be posting that sort of thing. And then the federal package that the president rolled out, the 15 days of pause, that package, if you don't have state specific guidance, also has some warnings to post if you'd like to post those in lieu of any state warnings that you have. And of course, you should already have hand washing guidance in your restrooms and at your washing stations. This is an example of what Kentucky's done. They have created a website, Kentucky COVID-19. They have a televised briefing by the governor every day at 5 p.m. and you can watch that on his Facebook page. All of the executive orders that are going into effect are posted in one spot. And then there's a hotline for people who are wondering, do I have the right symptoms? What should I do next? That they can call. And many states have a version of this. So you should look for this in your local area. We also have on our website some recent guidance. This was recent Friday, but now there's more guidance today. There's several different things that have come up today. So if you go to dinsmore.com and the very first thing you're going to see on the front page is a hot link that you can click for coronavirus guidance. It's free. You can look at these alerts by subject matter or by topic. So we've talked about workplace safety, the need for PPE, which is one of the reasons why you guys are not doing as much, because maybe all that PPE needs to be used somewhere else for emergency purposes, and also because you're not going to be able to work outside 6 feet of someone for the most part. And so if you can't be 6 feet away from them, they could be contaminating you and you could be contaminating them. And then when they leave and you leave, at least the data shows you will each contaminate a minimum of 2.5 people. And that is why this is just racing around. And some people, dozens of people, dozens of other people will be contaminated because no one who has the early onset is really showing enough symptoms to be sick enough to be home. And so for that reason, it's highly recommended that you're only doing emergency procedures. It's right now the executive order in my state, in Kentucky, and in Indiana as well. You cannot do those procedures unless you are doing emergency procedures. And you might also not have that order yet from your governor or your local public health authority, but you know that that is what our professional organizations have recommended. Just really quickly, we've got a lot of discrimination laws that apply to employers who have 15 or more employees. So I know some of you here on this call don't have 15 or more employees, and so you're not subject to the federal Americans with Disabilities Act or the federal laws that govern discrimination based on, say, national origin. But you might have a state law that kicks in at a lower level than 15 employees. And many, many states have this. So for example, I'll just use Kentucky as an example. Kentucky has a version of the Americans with Disabilities Act that applies when you have 8 or more employees. And so if you are a smaller employer, you should probably already know this, but your state may impose a similar law at a lower level. What does the Americans with Disabilities Act say? Well, if you're an employer that's subject to it, you can't make assessments about an employee's medical condition unless they pose a direct threat of substantial harm to the health of themselves or others. Luckily, the EEOC has told us that this is a direct threat, that the public health emergency status, both federally and in many states, has identified a public health emergency, and that screening your employees for the signs that we already talked about is not a problem anymore, as long as it's not done in a discriminatory fashion. It's done across the board in a way that's that follows business necessity. So what can you do right now, and what might you be mandated to do right now to stop the spread of the virus and to protect yourself and your employees? Well, encourage teleworking if you can. Have extra infection control practices. Designate who's going to be doing extra cleaning and where. Find out before people begin work if they're experiencing the influenza-like symptoms, and certainly send employees home if they have them. And then talk to them about the voluntary disclosure process that they should make to you if they have these symptoms. So you're either going to be asking them this before they start work, or you're going to be asking them to tell you before they start work that they have taken their temperature, etc. A lot of employers have asked us, well, can we require them to go out on sick leave if we think they should be out of here. Like they don't have symptoms themselves, but we're concerned that they've been exposed or something else, and we really like to order them home. And the answer to that is generally yes. So if an employee truly has been exposed to COVID-19 or thinks it's highly likely that they were, and they're going to be working within that zone of the 6 feet of a patient, they're at risk of exposing the patient even before they're exhibiting symptoms. And so in that case, because of the special circumstances of everything we just discussed, you can notify them that they need to be home, and you may have to pay them for that. We'll get to that in a minute. But the other question that arises is, well, can we have them bring a doctor's note before we let them back on the premises? And the answer is, generally that's a good idea. But right now, we're being told, at least in my state, that we shouldn't go to doctors, that they can, provide telemedicine, or they can provide a note from a distance if they're open or they're taking calls. But we don't want our doctor's offices flooded with people who just want a doctor's note or just want confirmation of some sort of pre-existing condition that they can use to get an excuse from work. What you cannot do is discriminatorily enforce policies. You can't tell people, well, if you're of Asian descent, we're concerned that you might have this. Or force employees to accept accommodations because, say, they're older. And we know that older people might be more threatened by this. So we can't necessarily say, well, everybody who's 60 and older should just go home and not come back. Similarly, we really can't require employees to tell us their medical history so we can determine, since you are all doctors, whether they should be there or not. You've got to wear a different hat when you're an employer. And so while the employee can tell you voluntarily, or the employee can have a doctor submit a note that says they are restricted from working due to an underlying health condition, you can't require everybody to start listing their medical history so you can go through that and determine if they should be there or not. Of course, you want to keep anything that's related to their disability, if they bring in a note or any kind of medical examination, including just getting their temperature, confidential like you would with any other record, and keeping it separately from a personnel file. So one of the questions a lot of employers have asked us is, what do we do with folks who are salaried and exempt from overtime if we can't work them the full week? We have just not enough business to work a full week, and we've really dropped our hours down to 1-2 days a week. And can we have our salaried folks, like our office manager, for example, working for 2 days a week and then not pay them for the rest of the week, pay a proportionately less amount of pay? And the answer is that that's a really risky thing to do. If they're exempt under the Fair Labor Standards Act, they're supposed to be receiving their full salary in any week in which they perform any work. So you can do one of two things. You could either group your patients into a week, be a week, working a week and then not working a week, and then working a week and not working a week. Of course, some of us are lucky to be working at all, and our guidelines are that we're only working in emergencies. You don't group emergencies week to week. You have to do emergencies when they arise. And so in that case, it's going to be smart of you to identify a select group of people who will work the emergency, and you can then basically idle everybody else for the full work week. If they're not performing any work in the work week, they're not entitled to any pay in the work week under the federal law. There's exceptions for state laws. The states also all have their own wage laws. Some states have a different rule. So this is subject to whatever state you're working in and looking at that rule. But for the most part, if they're not performing any work in the work week, you don't have to pay them their salary in that work week. What about workers' compensation? Some employers are just terrified that their workers' compensation is going to go through the ceiling. And we don't know the answer to that. The states are responsible for workers' compensation law. That is not a federal law. And in the pandemic context, it's really hard for people to establish where they got the virus. Genetically, you can figure out whose virus is related to, another person's virus, but typically they're not going to be able to prove that they got it at work or somewhere else. And so we think it's unlikely that you're going to actually, even if everyone contracts the virus, it's unlikely that unless they can show it came from work, that it will be part of your workers' compensation. That being said, states are trying to open up the workers' compensation laws to address this because they are concerned that some people, especially healthcare workers, could contract this at work and then be at risk if there's no safety net for them under workers' comp. The big question that everyone's asking right now is, what about paid sick leave? So many of you might already offer some paid sick leave or paid time off to your employees, and you are you would know how that works because you have a written policy that describes it. Some of you in certain states have a state mandated sick leave. And so if you have state mandated sick leave, we're going to be talking about something different, but it's a federally mandated sick leave. And so you may have personal sick leave that you offer just out of the goodness of your heart. You may have state mandated sick leave. And now there is a new, for the first time ever, federally required sick leave for COVID-19, and it goes into effect April 2nd, and it sunsets by its own terms December 31st of 2020. And what does it say? Well, if you're an employer with less than 500 employees, you're subject to this Family-Friendly Coronavirus Relief Act, FFCRA, which requires emergency paid sick leave under certain conditions. It's up to 80 hours of this leave for a full-time employee. And if you're a part-time employee, you're paid what your average hours would be for 2 weeks. There's also a new category of family medical leave for a public health emergency. And many of you out there don't qualify for family medical leave in the ordinary course, because unless you have 50 or more employees, you don't deal with family medical leave at all. So as I understand it, a lot of you who have tuned in don't have to offer family medical leave at the federal level. You might have a state version of it, but you aren't familiar with it at all because you don't have 50 or more employees. Well, guess what? Now, if you have any number of employees, one or more, and you have, but anything up to 500, you do have to worry about this special FMLA for only one category of leave that we'll talk about in a second here. These emergency leave provisions don't go into effect till April 2nd, and that is to give the Department of Treasury and the Department of Labor time to talk about how it will work. They're supposed to be explaining to us how it coordinates with your existing leave, how it coordinates with any state leave that's required, and how you will get repaid for it. Because what they've promised us is if you give emergency sick pay under this new law, you will be able to get an equivalent amount of money back, either as an offset against wage taxes that you would owe during the pay periods, or as a refund check. If you don't owe enough in the taxes, you might get the refund check, but it won't happen instantly. So it's an instant write-off when you pay your taxes, your wage taxes, if you don't exceed that amount. But if you do exceed the amount of offset, then you would get the check. IRS is promising to get it out quickly, which to them means 3 weeks. So if you look at the Treasury website, a lot of people are doing memes about this. IRS.gov coronavirus. A lot of people thought the IRS was a virus for a while, but now there actually is a website for the IRS. It's the listing here, where they're posting their guidance on what's been happening with taxes vis-a-vis coronavirus. So it's not all bad news. The only silver lining in this dark cloud hanging over our head is that taxes, as you know, have been delayed. So you still need to file your tax return by April 15th, but you don't need to file your check with it if you owe money. You can delay that until July 15th. And there will be no penalties or interest if you don't pay what you owe by April 15th. You still need to file a return, so don't just ignore it. File the return. This is also true if some of you would file an extension of time to file your taxes till October. You can still file a request for an extension of time. You would have to pay by October, you would have to file your final forms by October 15th. And traditionally, when you file a request for an extension, you're supposed to include the check for your estimated tax payment with that request for extension. You won't need to do that this time. You'll just need to pay that amount by July 15th. So Treasury has told us that they're going to come out with forms in the next week that will show you how you take this credit. And they're also supposed to tell us whether, in conjunction with the Department of Labor, whether or not you can take the credit if your own PTO is running concurrently with the new emergency leave. Our general thought is that the government probably isn't going to want to give you a tax credit for your own PTO. The tax credit is supposed to be for this new special emergency sick leave. So if you're running your own PTO concurrently with the emergency sick leave, it probably won't be something that you can reimburse. And that is our concern. We don't know yet though, so I guess it's silly to speculate about it now. Let's wait and see what they do in a week. So what we have here for you, and I'm not going to go through every slide. I'm just going to note that it's here so that you can flip through it if it'd be useful to you or your office manager, are the practices that we suggest for setting up a critical response team, for determining who's essential and who's not essential, for creating your response plan, for communicating with your employees, and for implementing the best practices. I'm sure that because you're healthcare providers, you've already implemented best practices. You might already have communicated to employees something, but I think it's worthwhile to flip through these on your own time to talk about, to understand what you should be considering when you prepare these plans. And so we've covered setting up a crisis response team. And quite frankly, if you haven't already done the things that are listed on this site, right here, you're just too late. I think you already have done most of these things. Checking the websites for your relevant public health authorities every day, talking to your members of your team about what to do if there's an emergency shutdown, if you haven't had one already, and understanding the immediate changes in the law and the public health laws. Because remember, all those laws that I described to you earlier are suspended for in an emergency by the local, state, or federal government. And typically, they'll be really specific about it. But for instance, if you are a nursing home employer right now, the states have issued really clear guidance about what you need to do to screen your nursing home employees before they come on site, and really clear guidance about not allowing other individuals who are not healthcare workers into those nursing homes. And that's already preempted a lot of the local or state or federal laws that we would otherwise talk about today. So as you can see, it's going to be very local, very state specific. Here are some resources that we recommend checking to stay up to date. You should be able to click through these links to the websites that we've listed here, or if you can't click through because of the way that your system is configured, you can Google these things. They are very specific for, including the most recent guidance, and we have this up on our website right now, are the U.S. small business loans. So you might have heard that in the last 24 hours, all of the states have now opened up, they've filed the paperwork that's appropriate to allow small business loans to organizations that qualify as small business organizations. And that is industry specific. So if you want to know, am I a small business organization that qualifies, you should look at our guidance on our website and go to the link there where they have a list, and you will, it's a little decisional tree. You type in the industry code that you're part of, and your total number of employees, total revenue, and it's going to tell you if you're a small business that would qualify. Those are loans, not free money. So a lot of individually owned businesses don't want to take out a loan. They're already obligated personally on other loans, and they don't want more loans. But if you're interested, it's opening up a lot of money right now for short-term loans. We also have information about the COVID-19 response plan, the action items that you should take in order to determine how you can operate remotely, or if you can't operate remotely, whether you're going to terminate employees or whether you're going to just idle them but keep them on the payroll and let them continue to receive employee benefits. Of course, you have to develop your response plan for what to do if an employee becomes ill or is diagnosed with COVID-19. And that's true even if you're shut down. So even if you idled already, and even if you sent everybody out, you need to be aware if they have tested positive and within the 14-day window of the last time they worked, they could have been infecting patients or they could have been infecting coworkers. So you need to be thinking about that even if they're not at your work site, and even if your work site is closed and dark, how can you get in touch? How can they get in touch with you, and how can you get in touch with them to ensure if they have been tested positive that you've notified the proper authorities and that you've notified patients if necessary. So a few more action items. We're not going to go through all of these because we want to take questions. So last but not least, all these measures, even the most extreme measures of shutting down, are designed to try to stop the spread. You remember the slides that we showed you earlier. 15 days can make a difference if there's significant slowdown in person-to-person contact in the 15 days. And we're really hoping that, I think 6 weeks is probably more likely for America, best case scenario. But I do think that there's a hope right now that we can contain this. And there are South Korea did it, China did it, Italy didn't act fast enough. And so we want to be more like South Korea and less like Italy. So now we have a number of questions. I'm going to start with some questions that I've gotten from everybody so far. And then we'll take questions from Robert and Bobbi as you have typed them in. So one of the questions I'm constantly being asked is, who would qualify for this emergency sick leave? And if we're a healthcare provider, do we have to pay it? And that is because of the way that the law is constructed. And you might not have actually read the law. It might be helpful if I send the law along with these other slides so that you can see the act if you want to sit around and read the terms of the law itself. But basically, emergency paid sick leave falls under some really specific set of guidelines. And so it's not just anybody who went out just because you shut down your business. So employers are asking me right now, look, if I shut down my business and I just close my business indefinitely right now, do I have to pay the emergency sick leave because I did that? And the answer is, as far as we know, no. Now we'll still get the guidance in the next 2 weeks from the Department of Labor and the Treasury Department, but it's never been the case before that an employment law applied to an employer who just didn't have a business anymore. So if you're out of business, you're not giving people vacation time. You're not giving them sick time. If you're out of business, you're out of business. So then a lot of people ask me, well, can we do something short of going out of business that would still mean that we don't have to pay out employee benefits or the emergency sick leave or the emergency family leave? And the answer to that is we don't know. It will probably depend on exactly what you do. So if you are thinking about this now and you're looking at your cash flow now and you say, I don't care if I'm going to get tax credits soon. I don't care if I'm going to get a check from the IRS in 3 weeks. I cannot float employees right now for sick pay, 80 hours of sick pay a person. I can't do it. And I also am going to be ordered soon, if I haven't already been ordered, to shut down by the government because I can't operate my business and stay more than 6 feet away from someone. And so what do I do in those circumstances? And so in those circumstances where you see you don't have the cash, where your state has already shut you down because you can't comply with the 6 feet buffer, then it makes a lot of sense to me, although this sounds a little harsh, to just simply say we are indefinitely terminating our business. And we hope that this is a very short termination and that we rehire everyone within the next few days. But honestly, the way it looks right now is it's going to be a minimum of 6 weeks, best case scenario. And how many of you are, I guess, able to stay up for 6 weeks, 8 weeks, 10 weeks while we're worrying about this? The emergency family medical leave, for example, is a 12-week leave. A lot of employers are telling me right now, we cannot survive 12 weeks like the week we had last week. So if we can't go 12 weeks like that, we can't have people out on this kind of a leave. We just can't afford it. So it's something to think about. On the other hand, if you have a good cash cushion, if you have a good line of credit, if you know that your business is a really profitable business and unwinding it is going to be really painful and you're concerned about losing people that you've worked with for many years, you're probably going to want to go through that decision tree that we have in our slides and think about, does it make sense for me to, looking at my existing workforce, to keep some people and terminate other people? I wouldn't close my business entirely, but I would be terminating, maybe I don't need a couple of receptionists, maybe I don't need all the hygienists, I only need to essential staff of 3. In which case you're not terminating anybody's employment or everybody's employment, you're just terminating some people's employment. Makes a lot of sense for you to do that in a meaningful way, to think about your state and local laws. Would you have to pay out any earned but unused vacation on the last day of work? That's very local or state law specific. That is not a federal law. And so you're going to want to turn to your state and local laws to see what you have to pay people on their last day of work, whether you have to cash out those accrued benefits or not, whether you have a written policy in place that, and at work in a state where, like Kentucky, if you have a written policy in place, then as long as it's just administered in a non-discriminatory fashion, you're allowed to either pay people or not pay people, depending on what your policy says. So you're going to want to make those types of decisions. And unfortunately, like I said at the beginning, we usually do this in a matter of weeks or months. You don't have to do this in a matter of days. And so you're going to want to think about all of these things as you move forward. But let's get back to the specific criteria for taking sick leave. So if you have to pay emergency sick leave, when would you pay it? It's employee specific and situation specific. Nothing in the Emergency Paid Sick Leave Act addresses what happens when the governor tells you you can't be open because you're a danger to the public. But what it does say is, if an employee is unable to work or telework due to a need for leave because of the following reasons, then they're entitled to the emergency paid sick leave. The first reason would be if the employee is subject to a federal, state, or local quarantine or isolation order related to COVID-19. So this is a situation where somebody's been diagnosed positive, or they live in a household with somebody who's diagnosed positive, and the state, federal, or local authorities have quarantined them. That's a very specific thing. You're told when you're quarantined, you know it. Public health authority tells you this, and you've got to stay put until you're released by the public health authority. That's really not happening to a lot of people right now. The second situation where the employee would be entitled to emergency paid sick leave would be if the employee has been advised by his healthcare provider to self-quarantine due to concerns related to COVID-19. So this is a situation that we described in the beginning where somebody's family member or somebody that they've been exposed to has caused the healthcare provider to advise them to self-quarantine for 14 days. The third situation is if the employee himself is experiencing symptoms of COVID-19 and is seeking a medical diagnosis. So that's another familiar scenario. If the employee says, I'm reading this list of things and I have all these things and I need to stay home and self-quarantine, they're going to be, if they seek a medical diagnosis, then they're allowed to do that. Well, a lot of employers have said, what does that mean to seek a medical diagnosis? Does that mean I get to have a doctor's note that comes back and says, I saw this patient and the patient was diagnosed or wasn't diagnosed with COVID-19? And the answer to that is the reason it's phrased the way it is because, as you know, we don't have enough tests. Most states are rationing those tests and have asked healthcare providers, including pharmacies that might have private tests available from LabCorp, to keep those for the sickest patients right now. They want to prioritize those for people that are really exhibiting severe symptoms. And so right now, in most states, this test is not widely available. A person may have all the symptoms that I described to you, even the enhanced symptoms, and they might not be able to get one of these tests because they're not in acute distress. And so if they're trying to get the medical diagnosis, but they were told either through their state hotline or some other provider that you can't come in, you don't qualify, we don't have the test for you, then we're being told that that counts. The other way that they can be subject to the emergency paid sick leave is if they are caring for someone who was ordered quarantined, or if they're caring for somebody who's been advised by their healthcare provider to self-quarantine because they've been exposed. So again, a situation with a family member or any other individual that they're caring for. And last but not least, if they're caring for a son or daughter and that child is no longer in school because of COVID-19, or because the caregiver can no longer watch the child because of COVID-19. So here in Kentucky, child care centers, generally, licensed child care centers cannot operate right now. They're under the emergency suspension order, and our schools are also closed. And so if you're in a situation where you've got to care for your son or daughter because of the closure of an elementary school or a high school under this act, you are entitled to that emergency paid sick leave, but you get a reduced amount of money while you're off. So you get 80 hours if you're full-time, but instead of being paid at your regular rate, you're paid at 2/3 of your regular rate, up to $200 a day. There's also a sort of an escape clause, and this is the one that we think might get invoked in the next week by the Department of Labor. And the escape clause is, employees experiencing any substantially similar conditions specified by the Secretary of Health and Human Services in consultation with the Secretary of the Treasury and Secretary of Labor. What does that mean? I think it means these emergency orders. So when governors are shutting down a place because it can't perform its services because it'd be in that zone, that 6-foot zone, that seems to me to be something that the Secretary of HHS may say, look, that should be covered. We didn't wait for people to get sick and then quarantine them one by one. We preemptively closed the business because the business is a threat to the employees and to the public. And when we've closed the business due to COVID-19, we really shouldn't wait till everyone's sick and dying of it. We should just go ahead and give the emergency paid sick leave. Of course, that gets us back to where we started this conversation, which is what happens if all of your employees are now not working because they're not supposed to be working, and you owe all of them 80 hours of sick pay. Can you afford to do that before you get the tax credits? That's going to be a really important decision you have to make, and you might not be able to make it today because we haven't seen what those regulations look like. They're supposed to come out this week. or sometime before April 2nd. We sure hope it's sooner rather than later. But we don't know what those regulations look like. And we, generally speaking, Treasury has said it wants to give as many credits as possible, as many tax credits as possible. So Treasury's been writing really broad guidelines, and they've put out a couple of memos on this, but they still don't have their forms and their guidance online as of noon today. Haven't checked since noon. So, so I think this would be a good time, Robert, if you have any questions about the emergency paid sick leave that we could take right now, while we just talk about that aspect of the new law.
We do. We have quite a few questions, and you've answered quite a few of them. Thank you. Let me just start with, are there any offices 15 or less employees or 50 or less employees exempt from that, that act?
So the answer is there are all the acts broadly cover all employers with less than 500 employees. So if you have less than 50, you're still covered. If you have less than 15, you're still covered. There are two exemptions that might apply to you. The first one is that on a employee by employee basis, the employer who's a healthcare provider can remove individuals who are literally healthcare providers as defined by the Family Medical Leave Act. They can remove those individuals from coverage. And who are healthcare providers? Well, the Act has a regulation that lists those folks, and they are, for the most part, are licensed and boarded professionals. So if you're a dentist, if you're a doctor, DO or MD, if you are a nurse anesthetist, if you are a nurse practitioner, but not your general hygienist, not your general nurse. So healthcare providers themselves that are highly licensed and regulated and highly trained for the most part. But so person by person, if you have several dentists that work in your practice, they would not qualify even if they're W-2 employees. You could exempt them from this paid sick leave. You can also exempt, if you are a sophisticated practice, you have nurse anesthetists or something like that, you might be able to exempt that person as well. And we'll probably see more guidance on this point. The other thing is that the law has this big escape clause that says, if you can show under regulations to be developed by the Secretary of Labor that complying with this would put you out of business, and you are an employer with less than 50 employees, then you may be able to not have to comply with it. We don't even know what that means because, again, we're waiting for the guidance. So Congress wrote this really quickly. They wrote this law in 3 days, and then they argued about it for 3 more days and amended it. But we just don't know what the Secretary is going to say about these small businesses. Now, what I will say is a lot of the people I'm talking to on this call are not 50 or more employees. And a lot of them aren't even 25 employees, perhaps. And so when you're really small, I should think that if you don't have the cash flow for this, I think it should be voluntary. I think we've urged, we and our lobbyists and the independent, for example, the group of independent small businesses, it's kind of like the chamber for independent businesses, for example. All of us are writing guidance, and all of us have talked to the Department of Labor, and all of us have sent in comments saying, you've got to make this voluntary on a case-by-case basis for micro employers, for very small employers. They cannot afford to float this kind of money, even though they're going to get it back, allegedly, under the regulations. And so we'll just have to see what comes out. It's a really tough position to be in right now, but you're going to have to just wait. And I'm hoping by the end of the week, we'll have some guidance on that from the Department of Labor. And they say they're trying to rush that out to us.
Okay, another question. The Family First Corona Act indicates that to be eligible, they must be employed for 30 days. Does laying off and then rehiring reset the clock?
So that's a good question. So let me clarify that. That is actually a part that kicks in on a different section of the law that we're going to talk about next. So when I'm talking about emergency paid sick leave, that applies to everybody who works for you, even if they started the day before the madness with the coronavirus. Okay. And so you don't have to work for somebody for 30 days to get the emergency paid sick leave, the 80 hours or your part-time equivalent of that. Okay. That provision kicks in when we talk about emergency family medical leave. And then we'll talk about that separately so we don't confuse everybody. So let's hold that thought till later. But right now, I want you to understand that everybody who works for you, full-time or part-time, who's worked any number of times, if they're on your payroll and they're called your employee, then they're part of this emergency sick pay in this act.
And if someone decides to terminate their employees while they are closed, yet they have a pregnant employee, should they be concerned for discrimination reasons or?
Yeah, so all those laws that we sort of skated past that say these are all protected categories, and when you have any employee that falls into any of the protected categories, the law puts the burden on you to show a legitimate business reason for the reason why this person was let go, and not the protected status that they're in. So pregnancy is a good example. It's a protected status. You would have the burden of showing that the reason that this person is no longer working for you is not because they were pregnant, but because something else, a legal business related reason, caused you to have to end their employment. This is most easily done when you treat everybody the same, or if you have very clear guidelines before you start laying people off that explain how you'll do that. And that is why you should go through the decision tree and make it an intelligent decision, even though you have to do it quickly. And what could that look like? Well, you may say, we don't know what things will look like in 30 days, 60 days, 90 days. We've got to take volunteers first. If anybody wants to be home, and we're gonna terminate a certain number of people. If a lot of people want to volunteer first, we'll take you first. You might have people that we're going to quit anyway because of exigent circumstances, who say, well, I'm going to go ahead and just quit right now, volunteer for being terminated. If they volunteer for being terminated, I would definitely terminate them as opposed to letting them resign, but keep it in writing from them that they chose to voluntarily be part of the layoff. That's so that they would qualify for unemployment, because if you voluntarily quit, you don't qualify for unemployment in almost every state. But you've asked for people to volunteer. You've said people must be laid off. You can't keep this staff. Take the volunteers first. The next thing you might want to take are last hired, first fired. That's an easy one to justify for a business related reason. These people have less experience, less seniority. We're going to take the people that were hired most recently and lay them off next. That's pretty simple to defend. If those people happen to be pregnant, it's still okay, because we showed that they were just the most recently hired, and that's why we laid them off. It gets challenging when you have very small numbers of employees to show criteria past the two things I just discussed with you, but you may be able to do it based on your business model. So you may say, well, right now in my state, I'm only allowed to do emergency operations. And for emergency reasons, I wouldn't need a hygienist. I would only need this person and that person. And so maybe you say, then I'm terminating everyone else based on the fact that they aren't critical to keeping emergency operations open in the next 30 days. And write that down, explain that that's your justification. And then again, if these people that are terminated fall into the protected status, you have identified the business related reason for letting them go.
Okay, there are a lot of questions of confusion with who can apply for unemployment. And if your team is on unemployment and you want to bring them in for an emergency procedure, or you want them to do some hours, can they volunteer those hours, or can you pay them, and how does it affect their unemployment?
Sure. We can't get too specific about unemployment on this call because every state writes its own unemployment law. And you will have to check with your own state law, some of which, like in our state, Kentucky right now where I'm sitting, the governor has issued a special executive order opening up unemployment to a lot of categories of people who would otherwise not receive it if they are not working because of COVID-19 and because of his orders. So the governor has issued this executive order that preempts our regular workers' comp law and provides special circumstances. So when you're looking to see what your law is, start with the website of your COVID-19 website for your state, look at your unemployment website for your state, and then look and see if there's some sort of special emergency order that's in place. Typically, if we didn't have this pandemic to worry about, if you terminated someone and then they worked for part of the week, but they didn't get rehired and they didn't get, how can I put this? They didn't return to their normal position of work. They simply came in on a one-off basis to work a case or two. That would be income that they earned during a week of unemployment that would be used to offset their other unemployment income, but it wouldn't disqualify them per se for unemployment. So let's take an example of you have terminated everybody and you've reported them as unemployed and they have filed for unemployment. Then you get an emergency case and you need to call some people back to the office to work just that emergency root canal or something. And so at that circumstance, you can convert everybody into a one-time, one procedure employment. So even salaried people can be paid without destroying their exemption from overtime by the case, as opposed to by another means. And so it gets a little tricky depending on your state law, but in general, the answer is yes. You could terminate everyone. You could bring them in on a case-by-case basis. You should make it really clear when they come in that they're not rehired, that they're working for you on a, not rehired to their old position of full-time worker, but they're just coming in for a single case, and what you'll pay them for that case. And it obviously has to be at least minimum wage to pay them for that particular case.
And just to clarify, if the government shuts us down and mandates that we're at home, we are eligible to have to pay our employees for this leave, this family leave, correct?
We don't know.
Okay.
That's a big question. It's out there, and we expect the Department of Labor to issue guidance on it, but we don't know.
Okay. Could you just quickly tell people the difference between furlough, laying off, terminating, and reducing hours?
Sure. In some states and in some laws, there's a difference between furlough and layoff. So again, you have to look at your specific location and determine what your specific law says. But in general, across employment law writ large, there's no significant difference in whether you call it a furlough or whether you call it a layoff. What's significant is whether you terminate the person, and therefore they're not working for you anymore, and they're removed from your payroll, and they're not earning any benefits, and they're being issued, for example, if you have a state or a federal or a COBRA requirement, that you've issued a COBRA notice, for example, if you're ending your employee benefit plans. So what's really important from a legal point of view is, how are you treating them when they're not in your office? If you've idled them, but you have kept them on the payroll and they're still getting their employee benefits, then they're not terminated. They're just in a period where they're just not working for you. They're on a temporary shutdown, a temporary layoff, a temporary furlough, whatever you want to call it. Your state might have a certain interpretation about it, given what you call it, but mostly the state wants to know what has happened to them. Have you ended their employment, told them that they're not working for you? Or are you still keeping them on a payroll and still offering them employee benefits, and you still consider them your employee, but they're just on a break? That's the legal significance.
And so can a furloughed employee collect unemployment?
Again, it's going to be state by state. Some states say if you haven't performed a certain amount of work for a certain period of time, whether that's because you were laid off or whether that's because you were just terminated, you are going to be qualified. In other states, it's going to be very specific that if you're not terminated, you're not entitled to the benefits. And we just have to check state by state what those state laws say. And then remember, don't forget there's executive orders out there right now that add to those state laws and open up unemployment where it wouldn't otherwise be allowed because of the COVID-19 pandemic.
And then how do doctors handle their medical and their retirement plans if they are laying off or furloughing employees?
So this is a very important question, and I'm glad somebody brought this up. So there's a whole network of laws that affect your employee benefits. It's generally a federal law, as well as the fact that you may have funded your employee benefits by buying a policy of insurance. And then that's going to be governed by both the law and your insurance policy. And under the federal law and the insurance policy, you should have a written plan document that describes your retirement plan. If you have even if you have a plan you purchased just off the shelf from Fidelity, there's a written plan document that goes along with it. And it should address how long a person is eligible to be on the plan and participate on the plan if they're not actively at work. It should have a whole section that talks about this. And generally it talks about it under eligibility or under separation from employment, or sometimes it'll talk about furlough in those documents too. And it will describe the length of time that somebody could be away from work and still be part of the plan, and when that time will end. It should be in your written plan documents. So you would start by looking at those written plan documents. And if it says everybody that's terminated has to immediately end the plan, unless they're rehired within a certain window of time, that will be your answer. On the other hand, you might not have it so clearly addressed. And then I would talk with your plan administrator about that. It is true that if you end your business altogether, you're going to have to unwind your plans. You're going to have to send notices. You're going to have to distribute those benefits in the way that is not going to be cheap. You have to pay a certain price to end your plan. So you should take that into account if you decide to actually close your business.
So there are a lot of associates on, and they want to know, some of them are W-2, some of them are 1099. They want to know what are their rights as far as unemployment, and also if they have a guaranteed salary, what are their rights?
Sure. So again, I sound like a broken record, but it's state specific. Typically what the states do is, if you're a W-2 employee and you're employed in most every type of job, you would be qualified for unemployment benefits, but there's a cap, pretty low cap, on how much you'll recover. So it's typically a percentage of your regular earnings. In some states, it's a very low percentage of your regular earnings, and in some states, it's a little bit higher. It's capped at a certain amount. It doesn't matter if you're salaried or if you're hourly. It looks at a window of time that you worked and then gives you a percentage of that. If you are a W-2 employee, you qualify for that in most states. If you're an independent contractor and you work for yourself, you don't qualify for it in most states. And so what the FFCRA said is that the government is going to open up a large amount of money to the states to spend on unemployment insurance that was otherwise not available. And the states have the ability to rewrite their unemployment insurance to open it up to as many people as they want to for this money in this window of time where we have this pandemic. And so we should be looking at those the state guidance, those state executive orders, state by state, to see what the states want to do. The federal government's going to let them do whatever they want to do. They might want to include independent contractors, or they might not. We should be looking for that. Like any day, it should be rolled out.
A lot of questions about, should we lay off our team or terminate our team members before April 2nd to protect us? And if we've already done so, are we protected?
Right. So we think the answer is that if you've already closed your business or at least laid off, all but your most essential employees, that you don't have to go back and pay any kind of employee benefit to somebody who doesn't work for you anymore. And that's just always true. So I can't imagine here that they'd want you to go find people that you terminated last week and then suddenly pay them a check. Doesn't make a lot of sense. That is why the Senate is supposed to be working on this other bill, which is supposed to provide $2 trillion worth of direct injection to, maybe through the IRS, to just people who aren't working, or people who need money, as opposed to having you pay the money to them and then the government pays you later. And so I think that if you've already terminated people, this isn't going to apply to you at all. On the other hand, if you terminate everybody after April 2nd, I can't tell you what's going to happen. So what a lot of again, because I haven't seen the guidance, and I do think there will be guidance about this, we just haven't seen it yet.
Okay, and then another question is, if you terminate your employees and then you want to bring them back later, you're open to be able to rehire them at whatever rate you want, and also can you rehire them as a 1099?
So those are good questions. The answers are complicated. So generally speaking, if you are in the same year and you have the same position and you want to keep somebody exempt from overtime, if you hire them back as an hourly employee, you're going to destroy the exemption that you were relying on to exempt them from overtime in the prior part of the year. So if you have an exempt from overtime office manager who really did work overtime, you wouldn't want to do that. You wouldn't want to change her to hourly midstream when you hire her back, because then you'd owe her overtime, potentially. I mean, there's a lot of nuance here. So I'm just talking really broad strokes. So before you would go through that type of exercise, you should think about it. Whether you can hire somebody to do a job as a 1099 employee versus a W-2 employee is also a very complicated analysis. It depends a lot on state laws. You've probably all heard about what California's done recently. But California is just a good example of the fact that, in general, the states and the federal government are very skeptical about hiring a person who would ordinarily do a job as a W-2 employee and only work for one employer, to hire them as an independent contractor unless it's something that's common in your industry. And so it's common, for example, in the emergency medical industry, that ER doctors can be independent contractors. And there's a lot of people that work in the ED, they have contracts, they work 1 or 2 weeks a month, or they're on again, off again, call duty, whatnot. And that's really common in their industry. It is not common, as far as I know, in your industry to have like a 1099 employee who's an office manager. That would be a little strange. And so if you hire them as an independent contractor and it's not something that is different from how they work for you as a W-2 employee, the state's going to be extremely suspicious about that. And how will they know about that? Well, they trace it all by Social Security number. So the Social Security number that you were reporting as a salaried person and a W-2 person 2 months ago is the same number that you'd 1099 somebody for at the end of the year. And if they get a 1099 for a person the same year that they got a W-2 for that person, they're going to want to know, why did you call them this? Was it just some sort of way to try to wiggle out of a tax? Yeah. So you be careful. Now, the one thing you can do is if you have people that you're hiring at a salary level and you can't afford to bring them back at that level, as long as you meet the minimum salary threshold for exemption from overtime, everybody might be coming back at reduced rates. The easiest way to do that without being questioned legally is to have everybody, or at least every job category, to be reduced by the same amount. And I have employers right now that have already said, we've got to either fire everybody or we're going to take everybody's salary down to just the base, from the top to the bottom. And so people that were earning a lot of money are certainly earning a lot less money. And that is allowed. So as long as you keep the minimum salary threshold, which is a little more than $35,000 for most white collar professionals in your offices, then you can take everybody down to 35,000 and whatever it is without a problem. Again, if it's really clear that it was for these emergency reasons.
Okay, and then for clarity, a physician's assistant is a high-paid employee that's exempt?
Depends on the state law, and typically under federal law, yes, because of the training, and they're an exempt professional under the exemptions for professionals. And so typically, yes, under federal law, but states might have a different opinion about that.
Okay, and if you wanted to keep your employees employed for 60 days and guarantee their payment, guaranteed their salary, you're going to start with PTO and then take them to a salary, are there any tax credits or tax rebates for that?
So can you explain that again?
So if you say, I'm going to pay payroll whether we're open or not,
right?
Can you get any type of tax deduction for that?
We don't know. So we're waiting to hear if this will be retroactive. So what if people started giving really generous benefits before April 2nd? Okay, I guess that's a variety of that question. The answer to that is we don't know. I think it's unlikely that the Treasury is going to say, whatever happened since the first part of March, you get to take a tax deduction for. What we're advising people, and we'll see when we see the guidance, we'll know more, is to just enact a COVID-19 emergency sick leave policy and a COVID-19 emergency family medical leave policy, copy what's here in the law, and then pay them accordingly and say, this is your emergency COVID-19 sick pay. And that way it's really clear when you submit a request for that tax credit that you're getting it for exactly what the tax bill allowed.
Okay. And what is the best way to ask for an exemption if it's putting your practice under distress, financial distress? What's the best way to try to get exempted?
So that's what we're waiting to hear from the Department of Labor. They're supposed to put something on their website with guidance about that. And what you're going to want to gather right now, if you think that's the case, are information about cash flow. So what was your cash flow before this? What was your cash flow last year? What are your expenses? I think that's what you're going to be looking at. And that's probably some version of what the Department of Labor is going to want you to submit, unless they just say that if you're a certain size and you made less than a certain amount of money last year in revenue, or you have less than a certain number of employees, we're just going to deem that you're not part of this.
Okay. And then can you just, you may have answered this, I may have missed it. Can you just let people know, are they required to pay for PTO, personal time off, or
when they're considering laying the team member off?
Correct.
How do they handle the accrued PTO?
Right. So this is a function in most states, it's a function of state law and what your written policy says. So in many, many states, the state doesn't require you to pay any amount of PTO as an employer, but you would have to pay whatever you would have to pay under your policy. So if your written policy says we don't pay it if we terminate you, we only pay it if you're working for us when you're earning it, well then we would not need to pay it. In most states, Other states have a minimum amount that you have to earn. You have to pay your employees a certain amount of paid time off, and if they haven't used it, you would have to pay it out with their last paycheck.
Okay. And some people are concerned that if we terminate our team members, then we're going to be violating some labor laws if we're trying to do that for the sake of not mandating sick leave.
Yeah, so that's a very valid concern, especially because this new law that we just described has a section in it that says you can't terminate somebody or retaliate against them for requesting the leave. And so this is why we've said it's going to be on you to show the legitimate business reason for why you can't keep people employed. And that could be, it's all these things we've been talking about so far. Legitimate business reasons could be like, look at, we have no cash, we have no patients, and we're laying everybody off. And so we're ending right now. And I shouldn't use the word layoff because it's a little confusing. We're terminating everyone's employment right now because we can't afford to continue. That we're not sure exactly what would happen in those circumstances, but if you really can't afford to continue, I think it should be pretty easy for you to prove that you just didn't have any money coming in. You didn't have anything that you could do to continue. And I don't think the law is going to require you to take out a small business loan if you don't want to as a business in order to just pay emergency sick pay.
Okay, and then we have a couple questions that are good questions, but they don't relate to what we're talking about as far as the sick pay. Is OSHA requiring N95 mask to see patients? Can I provide emergency treatment if I don't have an N95 mask?
OSHA has a pandemic guidance out. I would look at that, and then I would look at NIOSH's requirements too, to see what they're saying. What we have seen is that, I'm trying to remember where I saw it. I think it was just on the CDC website. They've got a whole section talking about this on the CDC website because people are running out of those things and they don't want them hoarded. And so I would just look and see what the latest guidance is. I know people are trying to do really strange and creative things about trying to sterilize the ones they have to keep using them. But so I'm sorry, but I just can't answer that.
So would you advise that emergency patients that we are seeing sign a waiver before we see them for any reason?
Like a waiver of what?
A waiver saying
getting affected by you?
That no, well, maybe, but a waiver saying that they understand that they're being seen for emergency purposes, that they're in pain, and that we're doing all that we can do to help them not contract the virus.
So I think it's really important to have information posted if you're seeing a patient that talks about all those things, that we're only seeing patients who are, for emergency reasons, and however that's defined. It could be defined differently, but I think you should define what an emergency reason is. And I think it's probably more important to have that, clearly defined for yourself under what would be appropriate standards than for, so you want to notify your patients of this? Yes. You want to post this somewhere? Yes. I don't know about signing a waiver because in a lot of places, just having somebody sign a waiver, I would call it an acknowledgement. Have somebody sign a specific acknowledgement that we understand that you can only provide emergency services, that they're in pain, that they believe that this is, they've accurately described to you the circumstances that they're under, and you believe that it also falls within what you would call an emergency service. Mm-hmm. And that you have taken I would list in this acknowledgement that you've taken every precaution that a reasonable employer would take to ensure that working on them wouldn't cause them to contract COVID-19, but that there's a lot unknown about it, and therefore you can't guarantee it. And do they still want to proceed?
Okay, I like that answer. There are a lot of questions coming in that she's already answered, guys, and we are going to have this recorded. So if it appears that we're not addressing your question, please go back and watch the video because she has addressed a lot of these questions. How can people find out if their states have an executive order?
That's a great question. So most of the states, I practice in Michigan, Wisconsin, and Kentucky, and all of those states have a website that the state has created on their state page that is a hot link that appears right at the top of the page that says, to learn more about COVID-19, click on this. You should look there first on your governmental website for your state. And then typically there's one of two things. Either the state has a few places that it tells you to go from there So it wants you to talk, like look directly at your public health website in addition to maybe one or two other websites. But when you're looking there, if you don't see something that's called an executive order or an emergency order, you should try to email them and ask where that could be found, because you want to see the actual order. The summary of it is usually so vague that you don't exactly know how it affects you. So look at the actual order. Most of them are posted. Most of them are a link on those websites.
Okay, and then let's take a break from the questions. You said you had something you wanted to dig into.
Yes. So there's one more section we've got to cover. We'll try to do this quickly because we're getting kind of close to an hour and a half. So that section is, what about the emergency family leave, which is what we had a question about earlier. So emergency family leave applies to all the employers with less than 500 employees and employees who have worked for you at least 30 days. So that's not all employees. That's just employees who worked for at least 30 days and employees who need the leave for a very specific reason. And that reason is described in the law too. And let me read you that reason. That is if the employee is unable to work or telework due to a need for leave to care for a son or daughter under 18 years of age, if the school or place of care has been closed, or if the child care provider of the son or daughter is unavailable due to a public health emergency related to COVID-19 that was declared by a federal, state, or local authority. And so that's not very many people on the one hand. On the other hand, it could be your whole office if you're in certain states. So it's a very specific need for leave. This leave to care for a son or daughter under the age of 18 whose school is closed because of COVID-19 or whose caregiver is otherwise unavailable. Maybe their daycare center is closed because of COVID-19. In that case, they get up to 12 weeks of leave. The first 10 days are unpaid under the family medical leave portion, but they could be paid under the sick leave portion. And then subsequently, they have up to 12 weeks of this leave that they can use, and they would be paid throughout this whole time at 2/3 of the rate that they would ordinarily earn, up to $200 a day. So again, this is something that you'd be eligible for that tax credit to offset what you're paying. You will be paying it at up to $200 a day, or if they earn less than that, if you're looking at 2/3 of their salary or 2/3 of their hourly rate, you would be paying them at 2/3 of the rate for everything after the first 10 days for up to 12 weeks.
And Mira, is this only cover full-time employees?
No, it's any employee who has worked for you for 30 days or more, but a full-time employee is going to obviously earn more than a part-time employee. And it has some rules about how you figure out how much you have to pay them while they're off.
Okay.
All right, and then there was scroll that back down so I can see.
So there was a question about doctors earning salaries that would make them exempt from unemployment benefits.
Mm-hmm. That's true. So some states cap unemployment benefits for highly compensated individuals. And so if you're earning more than a certain dollar amount, you don't qualify. Typically, they will pay you something if you're a W-2 employee, but they won't pay you very much. And so when I talked about how it's a percentage of your earnings, it's not really a percentage of their full earnings. It's a percentage of a percentage of their earnings. Mm-hmm. And so that they put that cap really low. So you just wouldn't be earning as much as you would if you were a person who had a different compensation level. And some states could exempt highly compensated individuals altogether.
And then it was a good question, is the Family Medical Leave Act kick in after this new federal 80-hour pay or instead of, in lieu of?
Could run at the same time, which is a little bit confusing. But so let's take an example of your receptionist comes to you and says, look, my child isn't in school. School's been closed because of COVID-19. I need to be able to stay home and take care of my child. That sounds squarely like the situation that's covered here in this act. She's worked for you for more than 30 days. So you give her the emergency family medical leave for 12 weeks. The first 10 days of it, you're not paying her under the family medical leave portion, but she would qualify under the emergency sick leave portion, right? So she'd be getting emergency sick pay because she has a covered reason. And she would get that at 2/3 of her regular rate of pay, up to $200 a day. And then after the first 10 days, or after she used up all of the emergency sick pay, she would be paid at 2/3 of her regular rate of pay for the remainder of time that she needs to take for the leave, up to 12 weeks. So a lot of people have asked me, well, what if school's out? Like, what if there is no school and school's out? And it sounds like a really good excuse to stop paying until you remember that probably if school's out, even if school's out, daycares might still be closed. So if they were regularly after school have gone to daycare, or if they would regularly go to summer camp and summer camp is closed, then you're still in the situation where their caregiver is not available because of COVID-19. So it might, the end of school might cut off this need for leave, or it might not before the 12 weeks are over.
And again, this starts on April 2nd, right? So it won't be retroactive?
Yes.
Okay.
Yes.
There's still quite a few questions surrounding exactly what people should do for their businesses. And I wanted to show this curve on the graph behind me, if you guys can make this out. The bottom curve here is pretty much, it says the rest of the world, but this is what the United States is currently doing in terms of its numbers. And this is called an exponential curve in engineering, okay? It's going up very, very rapidly. This curve here that you might not be able to make out is kind of leveled off, and this is China. This is China's curve, and this is based on the requirements that they put in place to make everyone stay home. The situation is that we are at the beginning end of, we are behind where China is. So from a business perspective, we're looking at probably around week 2 or 3 of this endeavor. They're at week 8 on this curve here. So the take-home point here is that in the next 6 weeks, as Lira had mentioned multiple times, for the next 6 weeks, it's most likely that this entire country is going to get a whole lot worse in terms of the sickness. Now, we don't want to take this and run with fear with this, but you want to use it as an input to your decision, because people are saying, should I lay off my team? And the question is, do you have the money in the bank to be able to maintain their salaries during this next 6 weeks? And or do you have enough money to pay the requirements that the government is likely to impose? The flip side that makes this really complicated is Lira's mentioned that there may be, in the future, there may be opportunities for us, because we're under 50 employees, not to have to pay some of these things. But at this point in time, we don't have that clear answer. We're looking for those answers, hopefully before April 2nd, when it's enacted. So if you're not a gambling person and you are not sure that the government's going to make this stipulation that 50 or under, then if you're looking for someone to tell you that layoffs for your team members is maybe something you need to consider, then I think that is a valid business decision that you're going to have to go through. It's one that we're all struggling with. There's not anyone on this call that isn't struggling with trying to figure out the balance between staying solvent as a company. And it's very important to understand, if we don't stay solvent as a company, no one's going to have a job. Like if the entire business goes under, there's no job. So if there's some way where we can get through this and come out on the other side and hire these people back, that's something that everyone needs to look at really, really seriously.
Yeah, and guys, there's a lot that we don't know, and it's changing every day, and that's why we have people like Lira who's available to help answer. Her company has attorneys around the United States available to help you in your state answer questions about your state. So if you want to reach out to them, dinsmore.com is dinsmore.com. They can put you in touch with someone who can help you in your state and answer the questions that you've been asking that we just don't have answers for yet.
Right, and please stay tuned, because I really feel like the federal government is doing everything it can to try to get some guidance out by Friday to help everyone decide what to do by April 2nd. And I know that if you've been looking at the things we've already talked about are important factors, that will get you, I think you'll, when you see the guidance, you might be able to say, yes, that's clear enough for me, I can't meet that, or that's great news for me because I'm exempted. So we'll have to wait and see.
Yeah, yeah. And guys, just to let you know, we do intend to do another one of these. Are we doing that tomorrow? 4 p.m. tomorrow. So if you want to tune back in, just reach out through the website
Yeah, we'll be putting some information out via
So we'll be sending some information out about things that you can do in your office now to help you financially stay afloat. These are just things that we would suggest and things that we're putting in place ourselves. And it's great for people to come together and ask questions and us to be able to see what other people are doing. So if you want to tune in, we're going to try to keep this going just so we can all figure out what to do to keep our businesses alive and keep our team members happy through this ordeal that we have going on. Lyra cannot thank you enough for helping us today. I'm so grateful that we found you. You've answered a lot of questions, and I know that there's still a lot of questions that people have. So please reach out to dinsmore.com and hire an attorney and ask for help so that you can have the best legal representation so that you can make really good, positive decisions for you and your team. And we hope to see you again tomorrow.
And we'll be making this recording available to all of you. So look in your inbox for an email that gives you a link to this video. There was a lot of content that was covered, and it's definitely going to take at least one more look through to really get to the bottom of all these questions. Yep. Thanks for tuning in, everyone.
Thank you, guys. Thanks, Lyra. Bye.